What's up, everyone? Welcome back to Shock Doc Medical. I'm Dr. Raad, and today we're diving deep into something that might just change the way you look at your skin. Have you ever felt totally self-conscious about a rash or skin lesion and wished your doctor would just get it? Well, today, we're unpacking the art and science behind taking a proper dermatological history. This is the unsung hero of skincare. It's how we figure out exactly what's going on and tailor treatment to you. Now, picture this. You walk into a doctor's office, maybe even a busy ward where privacy is hard to come by, and you're already feeling vulnerable about a skin problem. The first step is making you feel comfortable. That means I, as your doctor, introduce myself, ensure your privacy, and take my time to build rapport. I might start with a simple, please tell me about your skin problem, because hey, skin issues can be pretty embarrassing. We need to set the scene just right for an open conversation. All right, let's break it down. When it comes to skin problems, the exact words you use really matter. Terms like blemish, wheal, hive, scar, or blister can mean completely different things to different people, even to some of us in the medical field. For example, you might call any raised bump a blister, even if it's not filled with fluid, or you might refer to some post-inflammatory pigmentation as a scar. And don't even get me started on sunburn. To some, it's a serious burn, while others just mean they got a tan. That's why it's crucial for me to clarify exactly what you mean. Sometimes, you might even bring a photo along if your rash has changed or disappeared by the time you see me. This way, we ensure your description is as accurate as possible. Next up, it's all about getting on the same wavelength. I like to ask, what do you think is causing this? Or what's most important to you about your skin condition? This isn't just small talk. It helps me understand your preconceptions and expectations. And trust me, this is especially important for conditions like fluctuating inflammatory rashes, where what you feel might be very different from what I see. Your perspective helps us set clear goals for further investigation and treatment. Now let's talk symptoms, causation, and impact. I'll usually ask, how does your skin condition bother you? It sounds simple, but it tells me a lot. Does it itch? Is it painful? How does it interfere with your daily life, your sleep, work, hobbies, or social events? And here's another twist. We also explore how your condition might be linked to other factors like your work environment, the medications you take, including herbal remedies and health foods, and even your menstrual cycle in women. Skin conditions can be both disfiguring and embarrassing, and sometimes the treatments are messy, unpleasant, and time-consuming. That's why it's critical to know how this affects not just you, but also your family and caregivers. Now, I've got a checklist for you, a real deep dive into what we call Box 2.1, which covers questions about a rash. Here's what we ask. First off, where did your rash start? What did it look like when it first appeared, and how has it evolved since? Next, is the surface smooth or scaly? Is it flat, or does it pop up as a raised lesion? Then, the color. If it's red, does it blanch when you press on it? That helps us tell if it's just an inflammatory erythema versus something like purpura. We also ask, is the rash persistent, or do the lesions come and go? Is it cyclical? And if it's transient, how long does each lesion last? When they fade, does your skin show any changes in color or scarring? Finally, are your hair, nails, or even mucosal surfaces affected? Each of these questions is like a piece of a puzzle. It all adds up to the full picture of your skin story. Then we move on to Box 2.2, which is about how you perceive your skin condition. I might say, on a scale from 0 to 10, where 10 is the absolute worst and 0 means you're completely fine, how would you rate your skin condition today? It sounds simple, but it really helps gauge the severity from your perspective. And now, Box 2.3 digs even deeper into the symptoms and impact. What does the rash feel like? Is it tender, itchy, or downright painful? What exactly triggers the itch or pain, and what do you usually do about it? Does the itch mess with your sleep or your ability to concentrate? Is anyone else around you, like family members or even your partner, experiencing similar symptoms? This could be a clue, maybe even something like scabies. For pain, I'll ask, is it sharp, dull, throbbing, continuous, or does it come and go? Does the skin ooze any fluids, clear fluid, pus, or even blood? Is your skin fragile? Does it bruise easily or form blisters? And yes, we even talk about smells. If you've noticed any odd odors coming from an ulcer or skin lesion, we address that with sensitivity. Then I ask what makes the rash better or worse. Does it change with travel, work, or your hobbies? Does sunlight, weekends, or holidays affect it? What about cosmetics, medications, or even those trendy health foods? Finally, I ask about the practical impact. How is it affecting your everyday life, school, work, social activities? How long does applying treatment take, and what does it cost? And how's it affecting your mood, or even the stress on your family or caregivers? I know, it's a lot, but every question is vital to understand the full impact of your skin condition. All right, now you might be thinking, Doc, that's a heck of a lot of questions. And you'd be right. But imagine trying to solve a mystery without gathering all the clues. This is exactly what we do with your dermatological history. It's like being a skin detective. And once we've got the full picture, we can tailor the treatment just right. Speaking of treatment, while today's focus is on gathering your history, it's important to note that the treatment options come next. For instance, if we diagnose something like mild eczema, a common approach might be using a topical corticosteroid. You might be prescribed hydrocortisone 1% cream, which you'd apply twice daily to the affected area. Now, if it's a bit more severe, you might be switched to something stronger like beta-methasone dipropionate cream, typically applied once daily. But remember, the right medication and dose depend on your unique situation, and it's all based on that thorough history we just talked about. I actually had a patient a few years back who was super self-conscious about a persistent rash. She described it as a persistent blotch that would come and go, and it was really messing with her confidence. Once we went through these detailed questions, we realized it wasn't just a surface issue. It was affecting her sleep, work, and even her social life. By piecing together her history and understanding every nuance of her condition, we were able to craft a treatment plan that finally gave her some relief. And that's why this process is so critical. It helps us treat the person, not just the symptom. Now, I want to hear from you. Have you ever struggled to describe a skin problem to your doctor? Or maybe you felt frustrated when the terms just didn't add up. Drop your experiences or questions in the comments below. Let's get a conversation going, because trust me, your story matters, and sharing it could help someone else navigate their own skin challenges. Also, if you're a fellow healthcare provider out there, you know how essential it is to be thorough. These questions aren't just for show. They're the backbone of a proper diagnosis and a tailored treatment plan. All right, let's wrap this up. Today, we've taken a deep dive into the art of the dermatological history, from setting the scene and clarifying terminology to understanding the full impact of skin conditions on your life. This isn't just a checklist. It's a roadmap to getting you the best possible care. If you enjoyed this in-depth look at how we diagnose and plan treatment for skin issues, make sure to hit that like button, subscribe to Shock Doc Medical, and share your thoughts or questions in the comments below. And hey, join our growing community of curious minds who are passionate about medical breakthroughs. Next week, we're going to uncover another groundbreaking discovery that might just change the way we think about healthcare. Until then, this is Dr. Raad on Shock Doc Medical. Keep questioning, keep learning, and take great care of yourself.